a physician, I recognize this is not a medical issue, it's an issue of justice, and so we're really focused on non-medical interventions. And so the first thing actually for the whole group is on Thursday, we introduced legislation at the state level, AB 2258, which is going to have Medi-Cal cover doulas in California. So please help us.
I want to really talk to you about some legislation you introduced last week, the Gun Restoration Act. And in that legislation, really encourage us to start thinking about not only the acute community violence that impacts our wombs, but to be able to have research behind it, to really talk critically about how does gun violence impact us to be able to have healthy outcomes for our babies and for ourselves. And so that is my encouragement. In Sacramento County, we have had 0 juvenile homicides in the last 24 months. And that's because we are pounding the pavement, community-led initiatives, really making sure that both public and private strategies and funding come together to really work on gun violence in a really incredible way. So
elections matter.
Yes.
On this and so many other issues. But literally this point, CDC, the Centers for Disease Control should be studying gun violence as a public health issue. Take it out of the criminal justice and prison system and put it into the public health system in terms of what we need to do to deal with it and the effects of it. So I couldn't agree with you more.
Just context is so important. So if we only are looking at the numbers and we don't have that context, it leads us to certain different types of solutions than if we have the context as well. But I can't speak more enough about how we need more research funding, but funding specifically for Black, Indigenous, people of color-led research.
I just wanted to offer that we have to do awareness raising in all different spaces, and I'm so glad that I see all of these faces here, multidisciplinary community members who wear many hats. And when we're going into health systems to raise awareness and we're out in the community, it's important that we do more than just raise awareness. I feel like we've been in an awareness raising phase for the last 30 years with the Black Women Health Program. We have to do more than just implicit bias training in these spaces, because people, it's not implicit, it's explicit. I would offer, if it's not already written in legislation, I haven't read all the way through, that there's an accountability component beyond training. It's not just that you take this training, but your performance is going to be something that's adhered to and measured, or there's some type of fiscal impact that's going to happen. It should be enough that Black women and babies are dying.
It has to be about accountability.
Yes.
But it also speaks to generational things that we have dealt with as Black women, and just simply trying to birth our babies and and get the type of care we deserve. So our last guest is Ms. Hannaford, and she's...
So I'm a mother of 3. I'm pregnant with my 4th, and I'm 15 weeks today.
Wow.
When you are a professional in the field and you have knowledge of the healthcare system, and you have knowledge about your body and your pregnancy, and your health history, just how things are supposed to go. So you walk in kind of empowered when you go to the doctor, It's a fine line, because I get it on both ends. When I started off as a lactation consultant, I was the first Black lactation consultant in the hospital that I work at. And I had to prove my knowledge. Pediatricians didn't trust my judgment. And it took time, and eventually they would say, oh, well, I didn't know if I could trust what you were saying at first. But I do now, and you're really great with the parents, and you're really great with the teen moms. And I had one pediatrician say, well, I know you must be great with the teen moms because you used to be one. And I wasn't. So and if I was, it wouldn't have mattered. And what I said to her is, I'm great with all moms.
All right now.
And so I had wonderful pregnancies and I had wonderful births. But it was the experience and how I was treated. And I shouldn't have to come in and announce, my education level. I shouldn't have to announce to you that I'm a lactation consultant in order for you to take me serious. And that's the experience, you know, because when you work in the healthcare system and you see how people who look like you are treated, it hurts. You know, and you're having to apologize and say sorry and overcompensate for the poor treatment that your sisters are getting. And then you have to, you know, and then you, on the other end, you're a patient. And you come in as a patient, and I don't go in, I'm not gonna tell you anything about you because I wanna see how you're gonna treat me. I wanna see how you're gonna talk to me. Are you gonna show me respect? And I found that I got treated like the same women that I was serving. Until they found out, oh, you're a lactation consultant, then the whole thing changes. It shouldn't matter my degree, my education level, we should be treated with respect, period. And that's been the experience. So I ended up having my second baby at home. It was divine intervention because I had a midwife. I'm thinking, you know, I'm gonna go with a midwife. She was not a black midwife, she was a white woman. But she never trusted anything I told her. So when I told her, I think this baby's about to come, she said, you're still early. Call me back later. Not less than an hour later, my baby was coming, and I have her on speakerphone, like, this baby's head is out now. And so this time I want a different experience. So I've chosen all of my providers. I've chosen black women, OBGYNs that I trust. I've chosen licensed midwife that I want to do my home birth so I can actually plan for it this time, because my labors literally went from 8 hours to 4 hours to 2 hours. So I just spit babies out, and I'm hoping that energy keeps itself up. Now that I'm a elderly multi-grandmother. But you know, it's a different experience, and we shouldn't have to roll out our resume and our credentials when we walk into a doctor's office or clinic or hospital.